The deadly outbreak in a retirement community. At least 2 patients have died. Dozens more sickened. And tonight, parts of that facility are now under quarantine. ABC's Kira Phillips is on the scene.
Tonight, a deadly outbreak in Virginia. 2 deaths and dozens of residents sickened by a respiratory illness here at the Green Spring Retirement Community.
For a respiratory outbreak to occur in July would certainly not be as likely as for it to occur during the winter.
In just the past 11 days, 54 people have become ill, symptoms ranging from a bad cough to pneumonia. No promising leads on how the sudden illness broke out, but in a statement from the retirement facility, it says it has taken all necessary measures to fully implement proven infection prevention and control strategies.
David, health officials are testing patient swabs, hoping to figure out what this virus or bacteria is. Meanwhile, sick residents have been quarantined to their rooms. New residents are not being admitted, and all staff are wearing masks and protective gloves until test results bring about answers.
こんにちは、A ちゃんです。今ご覧いただいたのは2019年7月のアメリカの ABC ニュースです。アメリカで発生した原因不明の致命的な呼吸疾患を紹介しました。7月当時このニュースを見たときは単なる海外で発生した伝染病だと考えましたが、今から思うと非常に意味深いです。ではキーワードをまとめましょう。時期は7月、インフルエンザ多発の秋や冬ではありません。場所はバージニア州の退職者コミュニティグリーンスプリン。感染者は54人、うち2人が死亡。症状は激しい咳と肺炎。政府の対応はコミュニティ閉鎖と自宅隔離。この5つのキーワード、見覚えがありませんか？肺炎、高齢者に多発、強い感染力、閉鎖、隔離。新型コロナを連想せずにはいられません。さらなる情報をお伝えします。伝染病が発生した退職者コミュニティグリーンスプリンはメリーランド州のフォート・デトリック生物化学研究所まで車でたった1時間です。そしてその生物化学研究所はちょうど同じ時期の7月に突然閉鎖されています。何か問題が発生したのでしょうか。さらに去年7月から現在まで研究所の閉鎖に関する大量の英字ニュースが削除されています。番組やネット上どこにも見当たりないのです。このニュースの最後に遠投スワップ検査を行っているとありましたが、その結果は未だに発表されていません。感染の原因、ウイルスの種類は不明で、治療方法も分かっていません。しかし、そのまま放置されていたことになります。次のニュースをご覧ください。
The test that I took has 2 different antibody results. It has something called the IgG and the IgM. The IgM is the more recent, which would have shown that that antibody is more recent in my system. My body more recently fought the coronavirus. The IgG is the longer lasting one, and that's the one I tested positive for. I've been very clear that I tested positive for coronavirus, and I've been an advocate for corona antibody testing. And I've also been very clear that it is my suspicion, it is my sincere belief that it was absolutely in November and not in January or February. I've also received dozens and dozens of emails and probably hundreds of social media comments of people sharing my story and sharing their own stories with me, thanking me for coming forward because we were overrun from what I'm told in November and December with people very, very sick that tested negative for flu A, tested negative for flu B, tested negative for strep, that were going repeatedly to their doctors in November and December, and that were told that they don't have a flu, they just have bronchitis, they just have a bad cough, or it's a bad cold. And I think that we just weren't expecting it then, so therefore the doctors didn't know what to call it or what to expect. I by no means in saying that I'm a doctor and saying that I have proof positive, but it's very, very in my opinion, it's extremely likely based upon my own evidence, based upon my symptoms, based upon my timeline, and based upon the hundreds of other people who also believed they were very, very ill at that time period.
And without test kits, is it possible that those that have been susceptible to influenza might have been miscategorized as to what they actually had, that it's quite possible that they actually had COVID-19?
The standard practice is the first thing you do is test for influenza. So if they had influenza, they would be positive for...
But only if they were tested. So if they weren't tested, we don't know what they had.
Correct.
Okay. And if somebody dies from influenza, are we doing post-mortem testing to see whether it was influenza or whether it was COVID-19?
There is a surveillance system of death from pneumonia that the CDC has. It's not in every city, every state, every hospital.
So we could have people in the United States dying for what appears to be influenza when, in fact, it could be the coronavirus or COVID-19.
Some cases have been actually diagnosed that way in the United States today.
よくわからないが、インフルエンザに似ているからインフルエンザにしてしまうとの対応には疑問が湧きます。CNN のキャスターでコーモニューヨーク州知事の弟クリス・コーモ氏が新型肺炎に感染し治療を終えた後、新型コロナは去年の10月からアメリカで発生していたと思っている。私のような患者が随分前に大勢いたと言いました。イタリア、フランスなどの国の専門家たちも自国の新型コロナのウイルス株から見れば中国ではなくアメリカのウイルスとつながっているという結果を出しています。いくつかの事実に基づきアメリカの民衆は去年7月の患者に新型コロナの抗体検査をしようと呼びかけています。どうでしょう。アメリカ政府は本当に検査を行うのでしょうか。検査結果は発表するでしょうか。 WHO を拒否するトランプ政権が国際医療チームを引き入れる可能性はあるのでしょうか。待ちましょう。